Clinical AI models are capable of detecting malignancies years before traditional screening and mapping retinal damage to prevent blindness in millions of diabetic patients. But there is a hidden limitation beneath those capabilities. Out of the box, these algorithms are blind. A sophisticated AI cannot natively distinguish a lethal tumor from the healthy tissue surrounding it. To a computer, a high-resolution MRI or a CT scan is a grid of raw binary and hexadecimal values, lacking any anatomical context. To bridge that gap, the healthcare sector relies on a massive, largely invisible workforce. This is the field of medical annotation. Annotation is the process of taking raw medical data and adding precise labels. When a specialist draws a boundary around an anomaly, that raw scan transforms into a structured training example for the machine. The rule of artificial intelligence is simple: no labels, no learning. Every medical breakthrough attributed to an algorithm actually begins with human intelligence. To train these systems, we process various clinical inputs. Medical annotation covers 4 main categories: images, text, video, and audio. In image annotation, experts draw tight bounding boxes around tumors or meticulously map segmentation masks over cells on histology slides. It goes beyond visual imaging. Text annotators tag clinicals in summaries to highlight specific diagnoses and medications. Audio annotators listen to recordings, timestamping specific breathing patterns or vocal cues. With video annotation, specialists track surgical procedures frame by frame. This data teaches the AI to recognize specific surgical steps and track instruments in real time. The volume of data required is significant. A reliable AI model needs between 10,000 and over 1 million labeled examples before it can recognize a pattern consistently. Because these models learn at scale, a single mislabeled pixel can trigger thousands of incorrect clinical predictions once the system is deployed. Absolute precision isn't just a preference, it is the foundational defense mechanism protecting patient outcomes from these automated errors. To prevent failures, the industry follows 6 golden rules of medical annotation. Accuracy and consistency ensure pixel-perfect boundaries. Rule 3 requires deep clinical domain knowledge. Rule 4 mandates Inter-Annotator Agreement for quality. Finally, Rules 5 and 6 enforce strict privacy compliance and comprehensive documentation. These protocols have direct clinical impact. Millions of labeled fundus images have successfully trained AI to detect diabetic retinopathy. In radiology, text-annotated reports teach AI to draft structured summaries automatically, reducing the administrative workload for specialists. The higher the medical stakes, the stricter these rules become. An AI system is only as capable as the human experts who teach it. As medical AI becomes increasingly more complex, it relies more heavily than ever before on meticulous human review. This has created a massive labor gap. Millions of medical images await skilled review before they can be used to deploy safe, reliable AI models. Medical graduates, nurses, and radiologists are the primary candidates to fill this gap, bringing their existing anatomical expertise to these projects. But science students and motivated beginners can also enter the field by completing certified training to bridge clinical knowledge with technology. In our upcoming episodes, we'll walk through the actual platforms used in these projects, including hands-on tutorials for CVAT, Label Studio, and Scale AI. While software provides processing speed, the human experts who define those labels are the ones determining which tools are safe enough to use on patients.